I'm Dr. Kritika Mehra, and welcome to the Art of Patient Communication. Today, we will be talking about the power of connections. Recently, I have been traveling a lot, and as you would know, especially the people with families, you would know how busy this part of the year gets. End of the year, Christmas coming up, you've got schools finishing, tournaments, this and that. And on top of this, at the start of the year, I planned a heap of travel for me and my husband. I don't know what I was thinking. Anyway, so end of September, I'm sitting down with a calendar in my hand. I'm thinking, right, I'm going to write everything down of wherever we are going. So I have a bit of a structure in my head. So as I'm filling in the calendar for the month of October and November, I'm actually freaking out, getting overwhelmed. I'm thinking, what was I thinking? We have to go to Germany for my studies. My husband has to go to Spain for a training, and then I have to fly from Germany to Spain to see him there for a week, and then come back to Australia for 10 days, and then go back to India again for an Indian wedding where I have to kind of overperform because I am the daughter in law, and then come back to Australia for 10 days, and then go back to Sydney for a digital smile design conference, and then, study dentistry there, and then come back to Australia and then participate in all of the tournaments that has to be done. And mind you, in those 10 days when I was coming back, or we were coming back between our trips to different countries, we were still busy on the weekends going to and from tournaments which were not in the town where I live. So, which means more traveling. And just thinking about all this, it was just like I was crazy overwhelmed to the point like I was crying at a drop of a hat. It was a nightmare. And the main concern that I had was that I will have no energy to enjoy wherever I am, or I will not be able to make the most of it because I was stressed about, like in Germany when I was going there to finish my studies, I had to do thesis, I had to sit the exam, I had to present my thesis, and then I had to take these flights to Spain where I had to wake up early in the morning, and I think I was replaying the whole trip that was yet to happen in my head of how I was going to actually execute it. And my husband kept telling me, look, just take it as it comes, you'll be fine. But now I'm trying to just really like play it over and over again. One day, I actually thought, what is it that I'm really stressed about? Like, I have done this before. I can pack for, two different weathers. I'll be fine. I have luggage allowance. I know what I'm wearing. What is the problem? And it surfaced that I was actually stressed about going to India. So the stress was that, yes, I was attending a wedding for the first ever time as a daughter in law. I had a lot of responsibilities on me because I had to partake in some of the activities in the wedding. Yeah, and that was really bothering me. And more so, the most important reason that was making me worried was that I was actually going to go to my husband's native village, which is quite rural. Last time I went there, I couldn't sleep at all because there were frogs, there's lizards on the wall, and there's no air conditioning. So I really, really struggled. And all I could think was in my head was like, there are going to be frogs there in the shower. I will not be able to have the shower, and I will not be able to sleep because there will be lizards underneath the tube lights that just come down, and I was like, oh my god, like. Anyway, so I actually said this to Jimmy and said, look, I don't think I can do this. I was just freaking out the moment I realized that it's actually India that is making me worried. And the other thing is that the festivities for the wedding, they were all kind of packed into a day and a half, which meant that we had to change for different occasions every 3 or 4 hours. So the routine was jam packed. And most of the weddings on my husband's side, they're conducted during the morning, which meant that you had to start very early in the morning. And again, because was one of the main persons, I had to like wake up really early to make sure that I was actually organized and ready to go. And along with that, we were living in our home in native village where we were 5 or 6 5 or 6 ladies who had to get ready, and there was only one bathroom and toilet. And we were all equally scared of the frogs and the lizards. So it was not helpful at all. As the event was coming closer and closer, I was getting really stressed. And one day I just had this light bulb moment that I was the one who put my hand up to go to the wedding. I booked the tickets myself. So I have to be the responsible one and change my focus towards the positive things that, I haven't been to an Indian wedding for ages, and it's not about me. I need to get over myself, and it's about the bride and the groom. It's their special day. Yes, I am the facilitator, but it's about them, not about me. I actually thought, yeah, okay, let's focus on the wedding. And that's what exactly I did. I've had the best week of my life. I had so much fun. Believe it or not, like at in the middle of the night, we were actually waking up because one of my nieces would wake up in the middle of the night because she would spot a frog or see a frog, and we would wake up and move from one place to the other, or there would be a lizard on the wall or whatever. And we didn't sleep, but we had so much fun. We made so many memories. And I've recently received all the photos from the wedding. And as I am going through the photos, I'm so happy and so glad that I actually went there. The point that I'm trying to make is that just like my visit to the challenging rural village in India, we also get patients who are extremely difficult as well, or they can come across challenging because they're either have lots of questions, they are demanding, or they challenge our status quo. And when that happens, we can often get bogged by little distractions or little frustrations and actually take our focus away from their concerns and answering them. And this can be equally overwhelming. So, in this situation, it's often best to remember that I'm aware that this patient is challenging, and I am going to take my time to respond to them. And the best strategy that works is that not to feel the rush to answer them. Take your time, and that appointment should really be focused on data gathering. Do as many investigations as you can, ask as many questions as you can, and then it's okay to say to the patient that, look, I have got all the information, and I am now going to sit and study your case and then see you another day in a week's time so you can then discuss about the case. This actually will buy you some time to go back and reflect on how you are going to attend to that patient, and will also make you feel a lot more confident. And just like me, as I was saying, that I actually shifted my focus from the frogs and the lizards and the no air conditioning, it's important to shift your focus towards that one hug that you might receive from the patient at the end when the treatment will be finished, or focus on that one Google review that you will get, or referral that you may receive from the patient. So it's best to think about that and not going into the downward spiral. So strategies like being present in the moment where while you are having the conversation with the patient, getting to the core issue that patient is actually pointing at is very important. Give you a very short quick story that happened with me last week. There was a patient who was there to seek second opinion from me only because she mentioned to her regular dentist that she's unable to do the treatment or get the treatment proposed by her dentist as soon as next week. That was the only concern that patient had. She presented to me saying that, look, I want to know your opinion because I felt pressured at my usual dentist where she's been going for years, and that just disappointed her. So what I'm trying to say is she was not ready to have treatment done. She just didn't want the treatment as soon as next week. So that just put her off completely to the point that she's been seeing this dentist for years, but now she's like, no. I think addressing the patient's main concerns and understanding them is extremely important. To wrap up this podcast, I like to say that the most rewarding connections, whether it's in a rural village or it's with a challenging patient, they are only built when you come out of your comfort zone. When you will reflect back at these moments, it will only bring happiness to your face because, as I said before, you will either see them in the form of a hug, or they will give you a Google review, or they send you a reference, or they will say to you that I only would like to see you from here on. And these are the best moments, and you will live them forever. So, next time when you walk into your surgery room and to see a challenging patient, tell yourself it's not about me, it's actually about them. Thank you for listening, and I hope you got something out of it. Follow me on Instagram and do not forget to subscribe to my channel on YouTube. Bye.